So talking about the consultation science, this is where we are actually starting the interaction with the patient, where we are building up the rapport with the patients. And this is the time, this is your best time to know about them. And the better you can know about them, and the better you can know about their problems, the better you can help them. Look, I would really like to impress on this that I don't want this to become as a tool that you are using for the patients. It has to be genuine, it has to be authentic, that is very important, and it has to come from the heart. Because believe me, everyone has done some sort of a management training in their life at some stage. If you are using your verbal skills, your management skills, your ways of trying to get to do someone without being genuine and authentic, they will sense that. And that is the biggest problem that can happen, because then you are really not building that rapport, or you are actually destroying that rapport that you are trying to build through consultation. So the most important thing, like as I would like to say, is consultation is something where honesty and truth are the currency. And you have to use that to build up the rapport with the patient. Okay? One very important thing that I would like to impress here as well is that consultation is usually the most overlooked part for dentists and for clinical dentistry. This is something which is not dealt in great details in universities. And even after the dentists come out of the university, or once they have done their licensing exams and things, they are more focused towards how I can do a filling nicely, how I can do a beautiful crown. What they do not understand is that all that follows the consultation. So once you have spent that time with the patient, once you know what you are going to provide to the patients, and the patients have developed that confidence in you, that is the time when you actually can perform the clinical work. So it's very, very important to understand the consultation science in the greatest details you can. And the most important thing is that it is not one of the other strings in your bow. It is not an accessory thing. It is something which you have to be excited about, something you have to look forward to, because that is what will show through in your consultations, and that is what the patients will perceive. Okay? So let's talk about this further. What we are talking about here is, this is something very important for us to understand, is that if you cannot do a good consultation, if you cannot essentially communicate this to the patients, that this sort of work is very important and is needed by them, you cannot generate the work. And if there is no work, then where are you actually going to show what you can do clinically? So it's very important to understand for people, or for dentists to know this, that for you to be able to do a good crown, what is very important is for you to have a patient who understands the need for the crown. So knowledge and understanding and passion for clinical dentistry is important, but what I really would like to impress is you need to be equally passionate about doing your consultations properly.